Well, hello everyone. Thank you so much for joining us. My name is Julie Alver. I'm the marketing manager for Thrive Economic Development. We are the economic development organization for Jefferson and Dodge counties. And this is our second peer session of the week. Our focus for this one is bars, restaurants, and cafes. But just like in the previous session, we welcome folks from any industry. So if you're here from another industry, we're happy to have you here. And so the purpose of these sessions is to create a forum where we can have more focused conversations on how you're being impacted by COVID-19, maybe share some creative ways you've pivoted your business and discuss some best practices as everyone looks forward to getting back to business. I think you entered the meeting on mute, but this is a conversation. So, once we get started, let's unmute. You can feel free to unmute to ask questions, make comments. There is a chat box if you would rather go that route. We're recording this session. I'll have this up on our website in the next day or so. You can find us at thriveed.org. Let's see, I did send out a couple of documents about an hour ago that we got from the Jefferson County Health Department and Watertown Health Department. If you registered within the last hour, you wouldn't have received them. So I will check the list and make sure to get those to you. I think that's it. I just want to introduce our panelists now. We have Vicki Pratt, President of Thrive Economic Development, Kevin Kaufman, Director of the Wisconsin Small Business Development Center at UW-Whitewater, Gail Scott, Director of and Health Officer for the Jefferson County Health Department, Eric Fromgen, I hope I'm saying your last name right, Eric, President of the Jefferson County Tavern League, Carol Quest, the Director and Health Officer for the Watertown Health Department. She will be joining us a little late. She's on another Zoom meeting right now, so she'll make herself known in a little bit. But with that, I'm going to turn it over to Vicki.
Well, thanks, Julie. So what we want to do today is, as Julie said, have a conversation, understanding as perhaps a bar owner, a restaurant owner, a cafe owner, maybe of a coffee shop. How are the guidelines? Have you reviewed the guidelines for businesses in your industry sector? How do you intend to implement them? Which ones do you think work for you? Which ones won't work for you? Talking a little bit about what the impact of implementing those guidelines might be for you. We've certainly had lots of conversations with a variety of businesses in different industry sectors about the guidelines, and different industry sectors have different guidelines, how that's going to affect you and what different businesses think will work for them and what they think won't work for them. How do you think this entire pandemic is going to affect your business short-term and long-term? Wondering if you're promoting your business as guideline compliant right now, or if you feel the need to do that. And also want to talk a little bit about, critical lessons learned as you've gone through this past 2 months, so that we can learn from one another. So this is really, I don't have a lot of preaching to do, and anyone who knows me should just not, don't smirk. I don't have a lot of preaching to do here. It's really about having a conversation. And so to start that out, I want to talk to Eric a little bit. Eric Fromgen, again, he is the owner of the Concord Inn, but also is Jefferson County's representative, president of the Wisconsin Tavern League for Jefferson County. And Eric, I'd love to hear from you. What are you hearing from other bar owners in Jefferson County as to their use of guidelines, how this is affecting them? So let's start with you, and then we can get to you, Kevin, later.
Yeah, it's really across the board. Some are trying to be as conscious as all those guidelines and trying to implement them and teaching their employees. That's probably more on the restaurant side of it. As a regular bar where you only maybe have one person as a bartender, it's a hard thing to follow with the face mask thing. And the more that I've been talking with the public that comes into my little bar, they're kind of fed up with the whole thing. So I don't push it. I just recommend what they can do. We have extra sanitation. And as you know, but if you don't know, I'll quick go over it, but we are one of the most regulated industries as far as working with the public through our health departments the way we do as far as safe food handling and things of that nature. So a lot of these businesses already know the situation of sanitation, you know, and what they can do. Some people are going to buck the system, you know, as far as gloves. There's so many different theories that I've heard as far as the glove thing. If I had to, for my personal thoughts, if I had to change my gloves every time I handle money or I do this or that, you know, I think it causes more problems or maybe spreads even sometimes more things to different areas of my bar if I got a contaminated glove. Because every time you take those gloves off, then you got to wash your hands and you're supposed to put on the new gloves. It's not feasible. So we do the wash water with bleach, spray bottles, you know, things of that nature.
What are people coming into your bar? Do they seem to be concerned about the guidelines say there should be 2 bar stools between people who don't come in a party? Have you seen patrons who seem to worry about that? You're shaking your head no.
Well, there may be some. It's only been a week, so once again, you know, as being a business associate, you know, it's going to be your program to do that. I mean, if you feel that you can attract more people doing certain things, we have our own Facebook page. There's 1,000 hits on it the second day that we're open. Wonder what we're doing, you know, how we're doing things. We have certain areas of the bar where people can go, because like I said, I'm a little bar, so there's a back room as far as tables that are spread out 6 feet apart. They want to go back there and sit there, more than welcome to. And we have an outdoor little area too. We've gone with separate menus, or, you know, throwaway menus, you know, just the little things that, like I said, we've done a lot of this before, but it's just, I think more to let the public, it's more of a, you know, a show thing that we do care, and we're not just, you know, slamming people in and out of the door.
Sure. Thank you for that. And you know, to everyone on the call, Eric is a great resource. If you need his contact information, we can make that available. If you're a bar owner and you don't know who he is, you probably should know who he is. So let me turn it over to my partner in crime here, Kevin Kaufman. Kevin and I have been we put together the Back to Business program that launched April 1st. We've had outreach from 89 different businesses across the 2-county region that we've assisted in that time frame. And I know that many of those were bar owners. So Kevin, you want to talk about that a little bit?
Sure. So I echo some of the things that Eric was saying around, you know, the attempts, or at least the ability to take the best practices and try and implement them. I was in downtown Fort on Tuesday. One of the local bars there, Fat Boys, was open, and I just stuck my head in to see, and people were, you know, it was 2:00 in the afternoon, and parties were relatively separated, and things seemed to be going on just fine, and the bartender was wearing gloves, and you could see the extra care in terms of, you know, sanitizing the surfaces every time somebody moved or left, or those kinds of things. So you know, I think it's going to be real interesting to see. I also have heard the same thing that Eric had mentioned just as I was getting on the call, that some places are just saying, you know, we're not ready to open yet. In some cases, it's been we're waiting on our initial food orders. In other cases, and I'd be interested to hear from those out there. I have heard from owners that their employees have said, "Listen, I'm getting the enhanced unemployment. I'm making more money today than I would be, you know, coming in and working. You know, why don't you just let me ride this out, or, you know, pick me last, or don't open, or those kinds of things. So very interested to hear if that's playing a role in anybody's thoughts and decision patterns as we move forward. We also have seen, I think, the beginning of people taking advantage of the situation. I was given, and Vicki has seen the picture as well, of a bar that has a sticker that says they've been sanitized, and that has a 90-day guarantee on it. And, you know, we just are scratching our heads as to how you can sanitize a surface and guarantee it'll stay sanitized for 90 minutes, much less 90 days. So we suspect there's, you know, but I am seeing those places that are open that are doing well appear to be, again, making a very conscious effort and show of nothing to fear here. We're doing the best we can. Things like disposable menus, sanitizing surfaces. The big question is going to be is one, you know, what happens, Eric, when your place gets full, you know, and the next 3 people walk in? Do you know, at what point do you say, time out, I got too many people here? And, you know, those are some policies that I expect people will have to implement. On the restaurant side, what do you do when somebody comes in, gets one appetizer and a cup of coffee and wants to sit at a table for 2 hours, knowing that you're only at half capacity to begin with? You know, does that change how you handle crowds, and or how you handle table turnover and those kinds of things?
Thanks, Kevin. Eric, I'm wondering, have you heard from any of the bar owners that they have been, like, you know, packed to the rafters, and this is affecting their ability to adhere to the guidelines, or are they just packing to the rafters? What are you hearing?
A little of everything, you know.
Yeah.
Some are doing it, and you try to do what you do, but then, you know, you don't. Confrontation is not a good thing a lot of times.
Right.
Sure.
Especially in my business. Then as far as turning tables, there are some restaurants, one in Watertown on Main Street there, they're doing a 35-minute time, I believe, to flip a table over.
Okay.
Some have talked about, it's just talk. They're not implementing it, but like you said, if somebody comes in and has a glass of water and a donut and hogs up a table, some owners have been contemplating putting minimums, say whatever they're going to set at $50 bill, you know, an order, or 75, whatever, to make those profitable to be open.
Yep.
And that's why I think some are staying with the carryouts for now, until things kind of, in their mind, cool down.
Yeah, Eric, that's an interesting and probably a very smart thing to do. What I'm curious is, you know, how are they marketing that? Is that something that, you know, maybe they're putting out on their Facebook page that, you know, hey, we're open. If you need it, if you want to come in and take up a table, minimum order is whatever, $50.
Right.
Are they putting that out there?
Not yet, because I don't know. You know, legalities too. You know, I don't know where you would go. That's a slippery slope, I think. That's, you know, I let them figure. You know, I'm not going to go out there and tell people to do that. That's not, you know. But like I said, there's businesses that are they're trying to come up with totally different ideas than it was 2 months ago. You know, some are worried. I don't know if you're going to talk about this screening maybe later on, but taking people's temperatures, you know, how far do you go against rights of people, customers, you know, things of that nature.
Well, and I'm glad you brought that up, because as you know, and I keep saying, these are guidelines, right? So they are guidelines. It is not law. These are considered best practices in order to keep your employees safe, to keep your facility safe, and to keep your customers safe. Ultimately, you know, people have some flexibility as to what they're going to do and what they're not going to do. But I think, you know, directly to your point, this is, there are people that we know, because we hear from them, and our public health officer is on the phone. I know she talks to them, and I've talked to some of them. There are people who are concerned and will remain concerned and probably will not go out as a result of that because they are afraid, right? They're going to wear gloves and a mask as they drive down the road by themselves, right? So that's okay because that's what they want to do, and that's the level of protection that they feel is important for them, and that's fine. My guess is those folks are not going to show up randomly at a bar. And if they do, they're probably going to turn around and leave unless that bar is practicing the guidelines in the way that they feel comfortable. And that's their choice, right?
Yep.
And that's their choice. But to Kevin's point, I'm curious, are you seeing in your own business, or are you hearing from others that the enhanced unemployment benefits are, because I can see where this would have a huge effect on workers in this industry sector. Are you hearing that people are maybe not coming back to work, not willing to come back to work?
Yep. And then you take it a step further, the businesses that did apply for the PPP, now they have nobody to pay because they want to stay home.
Right.
It's a catch-22, and I think it's something the federal level didn't think about. I mean, it's one of these where it's a good idea until all of a sudden it shakes out a week or two later. You know what I mean? Yeah, to get an extra $600, and I've talked to my legislators. If this ever happens again, I would like to see a percentage put on that. Like if you only collect $100 unemployment, do a percentage of that 600, right?
Right. Yep. Yeah, there's an awful lot of chatter going on a variety of different platforms about how those types of benefits could have been rolled out differently, and it's fascinating. I think one of the things, as I threw out earlier, what have we learned, some of the big lessons from all of this, and businesses within specific industry sectors have certainly learned things, but I think as a country we're learning some very valuable lessons, and this ain't over. I mean, there's probably another 6 to 8 months of legislation that we're going to see happen out there to address a variety of different issues that are a cleanup to the legislation that has already been passed. I mean, that's Vicky predictions right now. So for what that's worth.
Yeah, so on CNBC yesterday, they had the chairman and CEO of the Landry's chain of restaurants, and he talked about what practices they're implementing. He said the biggest unknown out there is we can do everything right, and we're not sure if anybody's going to come back. We're not sure that people are going to, so that's the big question: is what will be the change in consumer behavior frequenting restaurants and/or bars.
Yeah. So what are you seeing right now, Eric, and what are you hearing from your customers or your other bar owners? Are people coming back? Are they coming back at the same numbers?
We had a meeting on Monday, my board, and it's a little too early to tell.
Mm-hmm.
I mean, I think it's going to be a 2 month down the road to see what happens. Like Kevin was saying, are they going to come, or are they going to come and see what's going on and then not come back because they don't believe what you're doing? How hard is our industry going to have to advertise or promote to try to get people back? And there's going to be a percentage, and that's understandable, that it's not going to come back. They're either used to doing what they're doing, or they're just afraid, like you said, or they just chose a different path. They're eating out more carryouts, or they're going to the local grocery stores, cooking more at home, things of that nature.
Well, we've certainly seen, the economic indicators for those of us that track that kind of crazy stuff. We've certainly seen the spike. And then on the flip side of it, we're also seeing some of the negative fallout. So here's a news item that has gotten a little attention as of late. Day drinking is on the rise. Imagine that. Which, of course, has had to have been done at home up until, right? I mean, depending where you were. But what does that mean? And certainly the online sales for some of these things, or the grocery store sales, have spiked significantly during this time frame. And a lot of that is indeed people staying home, people cooking at home, also people buying alcohol at the grocery stores versus coming into bars. So, but to your point, in terms of advertising, maybe advertising your compliance with guidelines or something like that, do you know of any of your members that are actually doing that, putting any signs in the windows?
Sure, there were some, and then with some other industry people, not in our state, I mean, it could be happening, but what I saw out in the state of Washington is one of them. People were actually putting mannequins at the empty tables, dressing them up to make it more comfortable.
Yep.
Things of that, but in the end run, though, I believe as a small business people, they're innovative. They'll come up with something. They're going to think of new avenues and different things to do. It's just what I hear, right? But
go ahead, Kevin.
I was just going to say, I think I just was hearing about the cruise industry and how they're planning to come back at some point in time. And the joke on the radio this morning was, I pay for that cruise so that I can go to 12 different buffets. Well, I'm sorry, but the days of buffets and salad bars are probably over, at least for the foreseeable future.
Yep. Certainly, that's what the guidelines are telling us. Back to that though, Eric, to your statement, I actually saw a full page ad in the newspaper from Total Wine that led with, the top 3 or 4 bullet points were all about how they're adhering to CDC guidelines, how they're compliant, how they're, following all of these particular steps in order to promote to their clients that it's safe, their customers, it's safe to come to Total Wine. You'll be taken care of here, right?
Right.
Yeah.
And I suspect, and this is just Kevin's opinion as well, that just as this is anecdotal, I can't put my finger on it, but people have become more comfortable going into the grocery store. I think that will happen again in bars and restaurants, that they will, as Eric said, test it a few times, and it'll be getting comfortable with the new normal over time. But that'll be interesting to see what the new normal kind of tops out at as compared to the old normal.
Has the Wisconsin Tavern League put out any projections as to what the economic impact has been to the industry in the state of Wisconsin from the closure?
Not yet.
No,
not yet.
At a national level, and I was listening to just some of these indicators earlier today. At a national level, we're predicting at least a 1-month loss of GDP for the United States, possibly more than that. So that's a significant hit. But as it breaks out into industry sectors, and this particular economist was doing some breaking out by industry sectors and really talked hardest hit is probably going to be anything related to the travel industry, hotels, lodging. And then a lot of it to follow up was bars, restaurants, and Main Street retail.
Yep.
Yeah. So is there anyone else on the call that is a bar, restaurant, cafe owner, want to pipe up and share with us, are you open? What's going on? What kinds of trends are you seeing? Remember, you have to unmute. It's very quiet out there.
Yeah, almost too quiet.
Are you people day drinking?
70 degrees outside, and we're before a long weekend, so maybe people are Zoom fatigued.
Zoom fatigue is a real thing.
Yes, it is, for sure.
Yeah, it is a real thing. So I'm also wondering, Eric, if you've heard from, as you said, some places haven't opened up yet because, of course, most places thought that they weren't going to be able to open until after Memorial Day weekend.
Yep.
Yeah. What are you thinking in terms of that post? Because typically we see from Memorial Day weekend until like that second week of July, because we do 4th of July for at least a week. That's usually a pretty strong revenue stream time for your industry sector. What are your thoughts around that coming up?
That the hardest part was getting our distributors online, you know.
Was it?
Well, they didn't want to have so much product because they didn't know when we were going to open, you know. Just for instance, like Miller Coors, we won't receive any keg beer now until hopefully the first week of June.
Wow.
Because it wouldn't last, or they didn't want to have production and then have it go. Because there was so much unknowns to this, and I guess that's one of the biggest frustrations. You know, there was the May 26th, but after that, what would we do, or where were we going, or even now, you know, I'm kind of hesitant to put tap beer back on because I don't want to eat that product, because our insurance industry is not covering loss of business, waste.
Right.
There's people in the industry that are doing lawsuits against certain insurance companies. Whether that comes to fruit or not, I don't know, but yeah. And then this is the busiest time of year now. Is one of the things that our state president did put out back in whenever that was, end of March, to try to be open by May 1st, or have some guidelines, and he listed everything that we've got now in front of us for bars and restaurants, trying to talk with the governor before this lawsuit and all this other stuff.
Yeah, business interruption insurance. I actually sat through a big webinar that was focused on business interruption insurance, irrespective of the industry sector. And by and large, an event like we have been experiencing is pretty much not covered by most people's business interruption insurance. And so what does that mean? Because, you know, the PPP programs, EIDL programs, anything else that we're seeing roll forward right now is not necessarily focused on making up for lost revenue.
No.
I mean, at all.
Right.
So that becomes an issue. I'm sorry, Kevin, were you going to pipe up?
No, just to agree with you that we're in the help there is to basically try and get your business to the point of opening, but nobody has really given a lot of thought about what happens when it doesn't come back, or if it stays at a low level for a long period of time.
Mm-hmm. Mm-hmm.
And then,
yeah, that's unfortunate. So
also,
go ahead.
I don't know how your program's going, but to step into as far as donating to nonprofit organizations. I mean, our industry is probably one of the biggest ones that do that. In fact, Wisconsin was almost $15 million throughout the state. Our county alone was 188,000 to 176 different charities.
Wow.
You know, and that's That's being modest because some bars don't like doing that, or you know they want to keep it private what they do for as far as charitable stuff.
Yep.
But yeah, we have a monthly newsletter, and on the front page of that letter, we always ask to please, you know, put in who you donate to. And in fact, our own Tavern League county level has a foundation, and that's what we operate out of, doing certain things like that.
Yep. And that,
So I guess to
interesting.
follow up with that is to hopefully we can still do a fundraiser that people are going to want to come to it. You know, things of that, you know, if being laid off or a bar not being open for so long, are they going to be willing to donate or anything, you know, any Main Street business, you know, the chambers and all that stuff, what they do with their fundraisers. It's going to be really interesting because usually in the fall is when we do the bulk of them.
Mm-hmm.
So we'll see. The veterans meals and that we do many charities.
You bet. And the bar and restaurant industry is really a piece of the fabric of a community. And as you said, some of the unintended consequences. If we're not open, we're not running fundraisers, those charitable institutions are going to be down a fair amount of revenue as well.
Well, you just think about some of the larger community events that are fundraisers in some way. I think of Rhythm on the River down at Fort Atkinson, right? Yeah. That's a massive revenue stream for the Chamber of Commerce. There are other groups that are there as well and are represented. And, you know, we all know that there's a whole lot of money made at that beer truck. There's a whole lot of money made, and that's not going to happen this year.
Right.
That's not going to happen. You know, other communities have canceled. I mean, look at all of the traditional Memorial Day weekend events that aren't happening. Every one of those had some sort of a fundraiser component to them in every community. So,
Vicki, I thought as we kind of looked at the census that there was a fair amount of municipal folks on our call today.
I think that's true.
Maybe we'd like to open up to them and tell us from a municipal standpoint how they're hearing and feeling, and anybody. Bueller.
Bueller. All right.
Alyssa says she can't unmute her phone.
Oh.
I'm not showing you as being muted right now, Alyssa. So maybe it's her microphone that's not turned on.
Oh, I see it as well. Let's see. Alyssa. Oh. Can we unmute her? Julie, can you unmute Alyssa?
I'm trying to now. There's a new feature where you have to ask to unmute someone. So there we go.
Okay.
Alyssa, I think you should be unmuted now.
She still shows as muted on my screen.
Oh, she doesn't show that on mine.
Maybe only you can talk to her. Technology.
Had to call in from my phone number. Unmute 358-3412.
Okay.
Oh, the 608 number down at the bottom. Okay.
Oh, there we go.
Okay.
Did that work?
Can you hear me?
Yeah.
Yes. Feel like Larry King. Chattanooga, go ahead.
Sorry, had some issues with my microphone on the computer, so I'm actually on here twice. I'm listed as on the computer and as a call. Well, Lisa Smith with Lake Mills Main Street program, and I'm just here to kind of listen to everyone else's wisdom so I can pass it on to our restaurants, because many of them aren't able to dial in or choose not to or forget about it. So I've just been sharing all of the various webinars with all of our businesses downtown. But as an organization, we are very event driven. We're a 501c3, and most of our fundraising involves sponsorships, and a huge portion of our sponsorships come from bars, restaurants. So it's really going to impact us this year. We've already had to cancel our Arts Fest in July. We have a big elimination raffle in August. We just canceled that this morning, and we've got a few more down the road. We've got a huge Knickerbocker Festival in February, and that is very strongly supported by our taverns and restaurants. So it'll be interesting to see. I'm not expecting any of them being able to provide sponsorships because they've just been hit so hard. So fingers crossed we can kind of get them back open, but everybody in Lake Mills is at a various stage of opening as well.
Yep.
Some of the taverns are opened. It looks like some of the restaurants are taking a little bit more time to open to figure out what they're going to do.
What about the brewery?
Tyranina, they opened Wednesday, beer garden only. Inside is not open, but I know we had Brew with a View scheduled
Right.
last week. That was canceled. So anyway, the beer garden is open, so that should be good. They can do some good social distancing there, being outside. We have a really small brewery downtown, a little nano brew. They won't be able to open because they're so small. They could.
Yeah, sunshine.
They're
Yeah,
6 feet.
Yeah,
Yeah,
sunshine.
6 feet is not an option.
you got to step outside to
probably
change your mind. Yeah.
What about Lewis Station?
They just recently opened. They're going to be open this weekend, and again, they've spread out the tables. Luckily they do have a patio to kind of spread some people out. I have some things penciled in to try to see if we can work out some plans with the city. I need to go measure some sidewalks and see if we can do some temporary tables outside to expand it. I don't know if the restaurants are going to be interested, but I'm going to do the legwork first.
Yep.
So and kind of let them know what their options are instead of waiting for them to come up with that option on their own.
And the coffee shop next to the bank? Can't think of the name of it. I apologize.
Cafe on the park.
Yeah, that.
Oh, no, the Hub? You mean the Hub?
The Hub.
The coffee shop that's in the big
Yep.
house?
Yep.
Their hours are really limited. They're not doing coffee in the morning at all. They're doing takeout dinners Thursday, Friday, Saturday.
Yep.
Where they have a couple options.
And the bar area in the back is very small.
Bar area is, the bar area is small. Right now they're closed until they figure out what they're doing. The Grist as well is closed, takeout only until they kind of figure out what's happening. So I think they're just trying to get their bearings.
Yeah, I live in Lake Mills, and there's the coffee truck that parks outside the Lake Mills Market. Seems to be doing a relatively brisk business. And last night we took the Two Guys Barbecue had their truck in town last night from 3 to 6. Yeah. Which
so
again, I'd rather go sit down somewhere.
Right. What I see for the restaurants and the bars, probably a little bit more for the restaurants, advertising the guidelines and all of the things that they're following, I think that's great. What I wish they would do a little bit more of is just getting the information out there. We as Main Street, we've had a lot of success with Facebook posts. People are sitting at home. I did a post for El Mariachi, and I think I had 5,000 people view this little video, and 250 people commented. So Facebook's been very very popular and very effective for getting the word out with all of the things changing. What I see the restaurants not doing is using that. It's a free,
Yep.
not everybody is on Facebook, but it is a free option to get the information out. And I'm just seeing them either not getting it out early enough or providing part of the information. So I've tried to educate our restaurants on, get that information out there, use pictures, pin a post to the top of your Facebook page, because people want to support. And this goes to the retail too. You have to tell them how.
Yep.
They want to order takeout. They want to try to support the businesses. So don't make it so difficult for them. Spoon feed them the information. Get your menu out there. So I think the guidelines and the safety is very important to let everybody know. But I think that other piece is just as important, because if people don't know how to support you, they're just gonna, go to the next person that has the information there.
Couldn't agree more, Alyssa, and what an important piece to just keep hammering home. And this is consistent with everything that we have seen with businesses reaching out to us throughout the pandemic for assistance. We have found that lack of a digital presence, or that maybe not using that digital presence as well as it could be used to promote your business, to continue to make sales of some sort. But you hit the nail on the head. Kevin and I have had multiple conversations about this particular issue. Lots of conversations with chamber directors across the two counties. Tell people how they can still do business with you, under what circumstances, under what conditions, what type of business, if you've modified something, if your hours are different, if your menus are different, if you're doing things differently. Just say to them, hey, we really look forward to seeing you. Here's how we can still engage, and get that out there. Eric, I'm wondering, does the Tavern League provide that type of guidance to its members as well?
Well, we do that, and then at state level, we also have a live Facebook feed. You can send it into them, and then they'll get it right up on the computers for everybody. You kind of have to watch that you don't, I don't know what the right word is, flood the system. Like when we were closed, my daughter would put up Facebook maybe once a week of what we're doing as far as painting, pictures of that, cleaning, just to keep people connected. I guess at the end of the day, that's what you want to do.
Yep.
But I think if you do too much, then they just oh, okay, that guy again. You know what I mean?
Mm-hmm.
Yeah.
But
well, it does have to be different.
Right. And we do the pictures. We haven't gone to the video thing. There was a concern for a while there, and I don't know where it's at as far as businesses promoting on Facebook. So I kind of had my business run under my daughter's name, because if you do too much, or they catch on, they kick you off, is what I've heard. It hasn't happened to me yet.
That actually, I don't think that's accurate, because Facebook is all about promoting. I promote businesses almost every single day. I do 2 to 3, sometimes 2 to 3 posts a day if there's enough valid information. I think it just depends on your content. I think if you're posting the same picture or the same content, that's not worthwhile. But if it's different, Facebook it'll show up in the feed. And what I'm seeing with some of the restaurants is they're posting once a month. Their last post was in January.
Yep.
So, and I think the online ordering is a great option as well. Some of our restaurants have implemented that. El Mariachi in town updated their website, and they implemented an online ordering system, which is fantastic. It's really easy to use. I believe they did it because of COVID. I think it's going to pay off well beyond COVID. I think people are getting used to takeout from restaurants, that they didn't consider takeout restaurants.
Yep.
And I think that's going to continue. I would have never gotten takeout Mexican food before. We would have always eaten it there. But I think after COVID, it's now an option. So I think things are going to change a little bit.
I think you're right. Based on everything we've seen, I think you're right. I don't think this is a blip in time. I think we will see some fundamental shifts in how a lot of different businesses actually do business going forward. And just as we've seen in the past 2 months, I think we're going to continue to see it. And Eric, I would guess that the Tavern League is probably going to be doing a lot of this type of training and support for its members on, how to do business differently.
Right, and that's what I was just going to ask with the health people, as far as Gail or Carol, if they're on. Some of the concern is with these carryouts, as far as safety. Can they eat it when it's cold, or once it's been cooked and it sits somewhere? They put it in the refrigerator and don't eat it till tomorrow morning. There are guidelines as far as how things get cooled down, and we're taught that in the industry, but I don't know that the public knows.
Right.
Maybe that if this leans more to carryouts and take home stuff, I just hate to see somebody getting sick and then tracking back to a below restaurant that, I don't know how we go about doing that, educating the public a little more about things of that nature.
About food safety specifically for the carry-out food items,
Yeah.
right?
Food handling post-purchase. Yep.
Post-purchase, yeah.
Right, or I've seen advertising from some restaurants where they sell you a raw steak and you go home and cook it. I don't think it's happening in our county, but I've seen it in like Milwaukee, that area. They're doing that. So
Eric, I know a farmer sell you a cow.
Right. Yeah, unfortunately, we got a lot of cows and pigs hanging around looking for places to be slaughtered. That's another whole webinar right there.
Yeah.
But Gail, are you able to respond? Is there some guidelines about post-purchase carry-out food safety?
Not that I've seen. I think we have to remember that people have been going through drive-throughs for a long time and they take food home. So I just think it's a little bit different because it's coming from a restaurant versus a drive-through. But, I think I'm not sure it would be any different than going through a drive-through or picking up Papa John's pizza and taking it home and cooking it. People should, I know I shouldn't say this, but they should be used to it and know what they're doing. If there is a concern, there might be some information out there. I'm not aware of it. But I'm also not aware that we've really seen any increases in communicable disease in that area. So I don't know if Holly is on, if she has anything else to say. While I have the floor, I just want to let you know that we pretty much had our largest number of cases reported to us in one day. So this is not going away. The cases, it's interesting that we're seeing are mostly coming in for the essential workers that did not, were working throughout, and now we're seeing spread through that community, as we have seen throughout the state. Meat packing plants, food processing, in those specific areas, as well as medical providers, people working in long-term care, all the way up to physicians. So I've heard of some emergency responders now that are testing positive. So, unfortunately, I think the message that a lot of people heard is the order was struck down and that it's go time. And so some people, like Eric said, they don't care. They're feeling like it's not going to hurt me, or I'm not going to get it. or I'm not going to, kind of that teenage oppositional behavior. I'm not going to let anybody tell me what to do. and I'm not saying that, that that they're bad people or anything. Of course not, because I'm sure some of them are my friends that are feeling that way. But it's just a little bit of maybe, like Eric said too, I agree. People got sick of it, people got sick of staying home and not being able to socialize, and it's fatiguing. He's absolutely right. It's tiring to do what we were doing. It's yeah, and the day drinking, Vicky, it all ties together. But unfortunately, this is a long haul outbreak. I often tell this story, and people probably are sick of hearing it, but when I first became a public health nurse, I studied the 1918 outbreak. Part of the reason is my grandparents were affected by it. My grandma and grandpa met during the war, and I know that there was issues with it that affected their families. And so when you look at that and what a long haul it was, and then when people sort of got fatigued and they said no more, then they saw a resurgence of cases. Oh, so I don't know if that'll happen now. That's just the whole thing. We just don't know what's going to happen. People want to guarantee that there's no risk, and we can't guarantee that there is no risk. I personally am very sad to see these events canceled. It's just a part of the fabric of who we are. But then I'm also saying that as a public health officer, I can't guarantee that they're not high risk situations. And so I would like to see, gradually people coming back and I hate to say it, but kind of testing the waters. And then we all agree that if we see a resurgence in cases in a hot spot or a certain area, then we all pull back together and say, okay, now we're gonna, we see that it's affecting this population and we need to do something about it.
Gail, I'm sorry, go ahead.
Yeah, the state also, I believe, had the largest number of cases reported yesterday. So, and people ask me, is it because they're testing more? For our people, some of it is because we're testing due to an outbreak. And not all the people have symptoms, but most of them do. So they're being tested. They're not just going in and being tested randomly. We did see some cases from the Dane County testing site, and some of those were asymptomatic, which is another scary thing about this virus, is that you can be positive and not showing any symptoms. So again, back to what Eric was saying about taking temperatures, there is a limitation on the usefulness of that.
Yeah.
And I do agree that that is somewhat invasive, and it is also, not that I'm not saying don't do it, but I understand the other side too, that there are people that almost see it like it's a medical exam almost. A lot of people don't care. I think the majority wouldn't care, but and then there's just the accuracy, of the thermometers. I'm sure that they can vary a few degrees. So it is difficult to interpret that as well. But that being said, I just would really like us all to know that we're all on the same page. I often feel like I have to apologize because I'm in public health, but we didn't start this virus and we don't want it any more than you do. I'm nearing my retirement, and I believe my whole rest of my career is going to be COVID-19, which to me, isn't the way I wanted to end my career. And I may have to extend it. I may be working a little longer just to make sure that the health department gets through this okay. So yeah, I mean, we're here to help. I would say that there is really an abundance of guidance out there. And I know we all feel like we have to send it out and help people, but I think by now people pretty much should know where to find it, or they can contact us. By noon today, we had gotten 14 calls for people needing guidance. So we're more than willing to help people out. We are not going to be the big bad guy. As you know, Carol and I both did not issue any orders. We just came out with a blueprint for reopening, so that should be on our website. But again, it's a compilation of the guidance that a lot of people already have. So WEDC and DATCAP have some great information out there. And I just feel bad for the employees who, you know, their lives have been upended, and then business owners, you know,
Yeah. They have.
I just feel terrible. It's affected my family. You know, the uncertainty, the fear of the unknown. Oh, and one other thing I wanted to mention that we're seeing is that people my age and older, or people with health conditions, they don't want to come back to work because of that. So you are going to be hearing some of that too if you have older workers or workers that have health conditions. And we are finding it even in the professionals. So we are looking at dentists, nurses that have been working in our safety net clinics who, you know, they were the volunteers. They were the retired people, and they do not want to volunteer anymore. So that's another kind of, that I learned today, a shortage that I wasn't even thinking about, that, you know, is going to affect getting health care to people that already have been hit hard by this virus.
No, you know, Gail, and thank you so much for everything you do and the public health department is doing. I think it's also important though to talk about, and it doesn't get as much press, right? But well, we've had 60, I think it was, confirmed cases in Jefferson County. We've had 3 deaths, and every one of those deaths is tragic. I'm certainly not downplaying that in any way, shape, or form. But on the flip side, that's a very low fatality rate. I mean, that's a much lower fatality rate than driving to work. And it's important to recognize, you know, that this doesn't minimize how scary this disease is for some people. I mean, it's frightening. You hear the stories of people who have recovered but have had horrific experiences in their illness stage. So Gail, I just wanted to say thank you for everything you've done and your department has done, and keep up the good work. And I hope that all of the businesses on this call know that the public health department is there to help you, not to hurt you. They're not there to close your business. That's not what they're there for. They're there to help. So thanks for that.
No, we know that a healthy economy is vitally important to health. You know, people can't stay healthy if they can't pay their rent or put food on the table or get health care. So we definitely know that it's very important. One of the other things that is interesting is that this outbreak, while we have a very low case fatality rate, that may change. And I know out in New York, there was a gentleman from Ixonia who Channel 12 out of Milwaukee did a feature story yesterday. Respiratory therapist, worked out in New York, volunteered, and said he had in mind 3 particular cases where they were in their 20s. They walked in, they were talking, they were seemingly, not in distress, which this disease is weird. You can have a really low oxygen rate and you're not
Yes.
showing distress, and then it's too late. And he said within 8 or 9 hours, all 3 had died. So it just, it takes a different form in different places. And it could be, now we're up to 60, I believe 67 cases. So, it could change or not. And
Right.
I think one of the things that we were seeing is that in Wisconsin and in Jefferson County, people were following the guidelines and staying safe. And that's why we didn't have a big surge of cases like some other places. And
Right.
also, we have a different socioeconomic makeup and healthcare makeup. So,
Yeah.
but things could still change. So we'll keep an eye on it.
Thank you, Gail. So if there's anyone else on the call that wants to ask any questions, I just want you to know that if you weren't able to get through, weren't able to unmute, weren't able to use the chat function, whatever the issue is, you can reach out to us. ThriveED.org is the website. You can find me at victoriap@thriveed.org. We can channel questions to any one of the panelists or anyone else on the call. But want to be mindful of everybody's time here. Has anybody else got anything to add for the good of the cause? You guys are all like partying early for Memorial Day weekend, aren't you? I'm coming to the Concord Inn.
I guess one thing, Vic, is I had asked my doctor the other day as far as, because I think I might have already had it back in January.
Mm.
And the consensus of the public people that I'm talking with, some people think they might have already had it. As far as looking for that antibody, and nobody knows if it's going to be like a vaccine to help you the second time or maybe. But just in talking the last 2 months after, basically a month ago, because once people got to know things, everybody has their opinions, but basically is they just wonder when this thing really started, or if we were already at the tail end of it, or if it's going to come back, say in October, November, or, because nobody really knows. And that's the hardest thing.
The ramp up on the testing and the ramp up on the antibodies will be the 2 short-term fixes until we can get to some type of a vaccine and or herd immunity, and we get to that tipping point.
Absolutely. Well, thank you. I want to thank our panelists. Thank you, Eric, for being here. Thank you, Gail, for being here. Thank you, Kevin. Really appreciate it.
Can I just say day drinking? Thank you.
Yeah. And you can't engage in day drinking if you don't get started in the morning. So
that's right. That's right.
Here's to a holiday weekend.
Thank you, Eric. Thank you, Gail.
Thank you.
Yeah.
Thank you, Vicki.
You
Thank you,
betcha.
Vicki.
Thank you.
We're gonna sign off here. Have a great holiday, people. Bye-bye.
Bye-bye.